Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and if you follow our site or our blog or YouTube videos, you know that I'm a big proponent of mid-facial rejuvenation. And when patients come in for eyelids, almost every patient that needs something done to their lower eyelids can benefit from mid-face rejuvenation. Now, one of the things that we do a lot are cheek implants, but fillers have evolved and they're so predictable and they last long enough that it's really a great way for patients that don't have time for surgery. They don't have time for lower eyelid surgery or for cheek implants. They can walk in and do a simple, minimally invasive filler injection in that region. So we have two things that we want to accomplish in these patients. They usually have fat bulges here, and we want to fill in front of the fat bulges to masquerade that, to make it look like it's one continuous area instead of a bulge and a trough. And the other thing we want to do is give back some of that youthful volume in the mid-face. And one thing about cosmetic surgery is that rejuvenation really equals youth. And youth equals volume and fill and curves. Young people have very nice fill in their mid-face and curves, and that's why when we smile, we look so much better. So we're going to talk to this patient now and explain this. Attractive patient in her early 40s, and she has a hereditary situation where she's got a little fat protrusion under her lids. If you look up at the ceiling for us, you can see how that pronounces that fat. You can look straight ahead. And now the other thing that we have here, which is very common, is we're very flat. So really this should stick out further than this. And she has kind of the opposite situation. Now her mother, who's also a beautiful lady, has the same type of fat protrusion, only since she's older, it's more pronounced, and she's truly a surgical candidate. So what are our options here? Well, we could do a little transconjunctival blepharoplasty and take some fat out with our laser without any external scar, and we could put some cheek implants in here. If you ask the patient to smile, that just makes this nice and youthful. Relax now. And so we could take some fat out, maybe do a little chemical peel to lighten the dark circles, and put cheek implants in. And that would be our surgical option. But this patient's not interested at this point in surgery, so what are our options? Well, we can fill the tear trough area and then come down here and fill the cheek as well. And by doing this, we really kill two birds with one stone. We're able not only to plump this area to make it look better and eliminate that shadow. A lot of times when people feel that they have dark shadows, dark circles, part of it is just a shadow that is cast by overhead light shining and that fat protruding makes a shadow. So when you stretch the skin there, it looks a little lighter. So in any event, double-edged sword. We're going to fill this, and then we're going to get some nice youthful volume in the cheek. And this has become such a huge and popular part of my practice that we still do a lot of eyelid surgery, and that's one of my favorite procedures. But there are many younger patients that can put that off for a number of years by doing this minimally invasive treatment. Put in a little local anesthesia so the patient is numb, and we're going to start here. And I like to start low. And if you can see, that tear trough is starting to fill up nicely. And one of the nice things we can do is do a lot of this fill through the same injection. So this is how we treat this tear trough. And it doesn't take a ton of filler to do that. We put a little Vaseline on here and massage. And we're just going to start blending this, and this is the area that we want to fill right there. You can see it fill up to masquerade that little trough that is making the shadow. And the nice thing about using fillers like Restylane and Juvederm is they're dissolvable. So you can see on this lid we have a pretty big trough. In here now it is much more shallow, so we're going to put a little bit more in there and then put some in the cheek. Previous side I show you how we kind of treat the tear trough, which we have not treated on this side, but on this side we're going to concentrate more on the cheek, and we'll do the tear trough last. Also, this patient is just took an ibuprofen today, so because of that she's going to have a little bit of bleeding or bruising. So we're going to go ahead now and fill this cheek. And we just want to plump this. It doesn't take a lot of filler. We just want some youthful rounding here to give some fill and some curvature. Now we'll slide up into the tear trough a little bit and work this filler up. And now we'll put some Vaseline on that area and massage this. And I think you can hopefully appreciate our fill. We're going to put probably a little bit more filler right in here, but now we have some nice cheek, and we've really improved that tear trough where we had a big groove there. So we'll go ahead and put just a little bit more in there, and that's how we do it. We have this last little bit. You can, if I pull the cheek down, you can see the volume that we have here in this kind of teardrop. And now what I'm going to do here is get a little bit more superficial, and we want to fill with accuracy this little groove right there. And there's a vein there which we want to avoid. So we're going to put some Vaseline on there. And the massage is very important. And last little bit right here. You're better to underfill it than to overfill it. So if you can remember, we had quite a deep trough right in this area, and this was flat. Now we filled that trough and we've got a nice curvature there. So she'll go to work tomorrow and be fine with it.